Guys, heart attack happens when a part of the heart muscle does not get enough blood. According to CDC, the more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. There are a number of risk factors involved in a heart attack, including age and family history. However, there are a number of everyday bad habits that can ultimately lead to the potentially deadly event. Please keep watching the video to find out more about these bad habits. Number 1. Avoiding daily exercise. One of the best things you should do to maintain heart health is exercise. If you avoid daily exercise, then it contributes to high blood cholesterol levels and obesity. According to Mayo Clinic, people who exercise regularly have better heart health, including low blood pressure. The Physical Activity Guidelines for Americans, second edition, published by the US Department of Health and Human Services, Office of Disease Prevention and Health Promotion, suggests at least 150 minutes, 2.5 hours of exercise weekly to help manage cholesterol and blood pressure. Cholesterol and blood pressure are two key risk factors for heart attack. So exercise daily and keep obesity and blood pressure at bay. Number 2. Facing stressful situations. Nearly everyone experiences stress at one point or another. However, avoiding it is in your best interest when it comes to heart health. According to Mayo Clinic, you have to respond to your stress in better ways because it can increase your risk of a heart attack. Guys, stress can increase blood pressure, and high blood pressure is one of the main risk factors for heart attack. So you have to find better ways to cope with stress. Resultantly, it can reduce your chances of suffering from heart attack disease. Number 3. Drinking alcohol. A glass of wine or a beer on an occasion is not going to lead to a heart attack, but if you are drinking too much and you are also habitual drinkers, then it can negatively impact your heart health. According to the experts of Penn Medicine, alcohol can increase blood pressure and also lead to a high level of triglycerides, the most common type of fat in your body. When your body has too many calories due to heavy and habitual drinking of alcohol, then the calories added up in the body and your body changes them into triglyceride, which can raise your risk of heart disease. Additionally, those extra calories can translate to obesity, that is, another heart disease risk factor. Number 4. Dining out daily. Guys, eating out on some occasion are not going to result in a heart attack, but dining out daily have negative impact on your heart, as you are more likely to make unhealthy choices at a restaurant when you do eat out. According to the experts of Penn Medicine, you should pay attention to nutritional details, saying no to bread and cocktails, making healthier swaps, choosing smaller portions, and resisting unhealthy toppings. Number 5. Habitual smoking, not just cigarettes. According to the experts of Penn Medicine, smoking is one of the biggest risk factors for heart disease that is responsible for almost 1/3 of heart disease-related deaths. On inhaling a cigarette, you are putting over 5,000 chemicals into your body, many of which are harmful to your health, and one of these chemicals is carbon monoxide. Guys, carbon monoxide decreases the amount of oxygen in your red blood cells, which damages your heart. It also increases the amount of cholesterol in your arteries, that is another risk factor for heart disease. Similarly, by using an e-cigarette, you are still exposing yourself to nicotine, toxins, metals, and other contaminants. All are dangerous to your heart health. So put down the cigarette pack and save your heart. Although it is challenging, but keep in mind that it is more difficult to live with heart disease or to recover from a heart attack. Number 6. Habitual drugs using. According to Mayo Clinic, some heart attacks are induced by illicit drug use. They explain that using stimulant drugs such as cocaine or amphetamines can trigger a spasm of your coronary arteries that can cause a heart attack. Number 7. Know the symptoms. Knowing the symptoms of a heart attack could save your life. The sooner you are treated, the more likely you are to survive without any major health repercussions. According to the CDC department, the most common signs are chest pain or discomfort in the center or left side of the chest that lasts for more than a few minutes or that goes away and comes back, feeling weak, lightheaded, or faint, pain or discomfort in the jaw, neck or back pain, or discomfort in one or both arms or shoulders, and shortness of breath. So, guys, know about your symptoms and treat accordingly. That's it, guys. Please hit like icon if you like the video and subscribe to the channel to get the latest upcoming videos notifications. Thanks for watching the video.